Medicaid expansion has been a major focus of the 2024 legislative session here in Mississippi. Well, now we have a look at what both chambers are offering. And the question remains whether they'll be able to reach a compromise to provide health care coverage for thousands of Mississippians. Well, 12 News senior political correspondent Richard Lake has more details on the House and the Senate bills. Now, Richard, how do they differ? How are they alike? What?
Yeah, well, so it's coming down to two main factors: how many Mississippians will be covered and how big of a role a work requirement will play for each plan. The Senate plan, the more conservative option between the two, covers those aged 19 to 64 who make up to 100% of the federal poverty level, a little over $15,000 a year for one person. An estimated 80,000 Mississippians would be eligible, and it includes a 30-hour weekly work requirement. Unlike the House plan, the Senate plan is dependent on that work requirement receiving federal approval. If the work requirement is denied, the plan will not go into effect. The House plan covers more people, has a lower work requirement, and a backup plan if their work requirement is denied. It would cover those making up to 138% of the federal poverty level, nearly $21,000 a year for one person. Roughly 200,000 Mississippians would be granted coverage, and it includes a 20-hour work requirement. Section 2 of the House bill mandates that if the federal government denies their work requirement, traditional Medicaid expansion would go into effect. House lawmakers contend that the House plan is the better option for Mississippi workers, while Senate leaders push for their more conservative approach.
The federal government says at least up into 138% of poverty, which is a single person making $25,000 a year. We ought to be willing to do that. One of the requirements under the Senate plan that they're going to cover people that make $15,000 a year. Well, you can't make $15,000 a year if you're not working.
What we're trying to do is, again, helping the working poor, giving them a slide up, a helping hand, so that they can get on at the low level, work, income can increase, and then eventually get on the exchange and ultimately get off the exchange.
While the House plan has a backup if their work requirement is denied, the Senate plan lives and dies with their work requirement. The Biden administration has not approved any expansion plans that include a work requirement. Democrats in the Senate say Mississippi's federal delegation can work with the current administration if need be, and Senate Republicans are hoping for a new White House.
But the longest-serving member of Congress from Mississippi has a direct line to the Biden administration, and with all of our efforts for the last decade or so, he's been in tune, Congressman Benny Thompson, with us trying to do the right thing for Mississippians without health care.
You also heard, oh, what happens if they deny it here? If we have a new president, we're going to have this bill passed.
Now, Governor Tate Reeves has said that he will veto any expansion legislation that reaches his desk. Both of these plans were passed with a veto-proof majority out of their respective chambers. Richard Lake, 12 News.